We go now to our reporter Laura Windsor, who has more on having babies after age 35.
There are an increasing number of women that are becoming pregnant over the age of 35, or as some doctors call it, AMA, Advanced Maternal Age. We spoke with Dr. Karen Hansberger at Redlands Community Hospital and asked her if it is usually safe for women 35 or older to get pregnant.
Most women do very well over the age of 35 and their pregnancies go well. There are just a few more challenges that you have to go through those hurdles as you face pregnancy later in your life. The first hurdle is getting pregnant to begin with, because as our eggs get older, they don't work as well as they did when we were 20. When you are 36 years old, it can take a little longer. Most people are able to get pregnant, but some of them find, especially when you get into your late 30s to early 40s, that you may need some professional help getting pregnant.
We asked Dr. Hansberger if women have more miscarriages when they are over 35.
I tell my patients as they get older that, you have to have a little thicker skin, because as we get older, the risk of chromosome abnormalities go up. And that doesn't mean that they're common. Most babies are perfectly fine. But because they are at higher risk as we get older, miscarriage does go up some. Most women don't miscarry over the age of 35, but it certainly is a higher percentage than when you were 20.
Dr. Hansberger talks about the tests available.
In the first trimester now, we used to do or offer amniocentesis for women over the age of 35. And with every year of life, your risk of chromosome abnormality goes up. That includes from 20 to 25, from 25 to 35. It's just when you get to 35 and older, those numbers start getting closer to home. So at 35, we have offered amniocentesis or chorionic villus sampling to test for chromosomes. But now we have first trimester screening, which is actually done at 12 weeks, which includes a blood test as well as an ultrasound where they look for something called a nuchal translucency. And when they look with an ultrasound at a baby between 12 and 14 weeks, it's like a little black skunk stripe that goes down the back of the baby's neck. And if that is wide, then there's a higher chance for chromosome abnormality. If it's thin and the blood test is normal, there's a very good chance that the baby is fine without doing any invasive testing. As you go through pregnancy, the older you are as a woman, the more likely that your genes that you've inherited are going to kind of kick in. So there is a 3 to 6 times chance that you may develop gestational diabetes, which is diabetes that's limited only to pregnancy. There's also a 2 to 4 times higher chance that you could develop hypertension in pregnancy, or something called preeclampsia, or the old term was toxemia in pregnancy. There's a slightly higher chance that women, when they deliver, can need a C-section for delivery. Sometimes that may be based on how well the uterus works as far as the contractions. Sometimes it's because the placentas can be lower in women who are older. And other times it's physical constraints like fibroids that grow as we get older.
Dr. Hansberger talks more on women having babies after the age of 35.
When you get a little older, you realize many times how beautiful it is. You may not have the stamina that you would have had when you were 20, and that's the downside a little bit, but the joy that comes. And 35-year-old women, 40-year-old women are usually healthy and able to keep up with their kids and really enjoy their children. And they also bring a set of resources, to financial and otherwise, to raising a child. And that's a real plus to any child coming into this world. So it should be something that's you shouldn't be afraid of it. As much as possible before you face pregnancy after the age of 35, you want to maximize your health. You want to maximize your physical condition before you get pregnant. But with a little bit of planning, it can go very well.
A woman getting pregnant at any age comes with risks, but having a baby is a blessing, regardless of a mother's age. For the American Health Journal, I'm Laura Windsor.